Good morning, everyone. Today we are at Serensa Health celebrating Women's Day. It is a day that we recognize women for their achievements in national, cultural, and linguistic boundaries. And we have our medical director, Major General Dr. Soumyesh Bhaduri. Welcome, sir. Good
Thank you.
morning. How are you?
I'm great. How are you?
I'm good, sir.
So let me wish you a happy Women's Day.
Thank you so much, sir. Same to you as
Thank
well.
you. Thank you.
Sir, could you please talk about the importance of women health?
Okay. Before I go into women's health as such, I would like you to tell me or reflect back of all the women that has been in our life, our grandmothers, our mothers, our sisters, our spouses, wife, or lady friends. How important are they in your life? And once you realize that, you will realize how important their well-being, their health is. So in that sense, it's a very, very important aspect. After all, they constitute, the ladies, almost 50% of our population. In some countries, which is
Correct.
a little more even. And obviously, you have got 50% of this population whose health cannot be neglected, and in that sense, it's a very important aspect.
Absolutely, sir. Absolutely.
The other thing that I wanted to tell you, I mean, if we are celebrating International Women's Day, I'd like to ask you, do you have any idea of what is the International Men's Day? Anyone? Well, it is supposed to be 19th of November every year, but we don't know about it because it is not as important. And by being not as important, it emphasizes the fact that Women's Day is more important because over the history, if you look, women have been neglected by the society, by the community, by the families, and most importantly, by themselves. So it is time that we wake up to the fact that we cannot anymore afford to neglect a very important part of our life, that is women.
Well said, sir. Well said. So we can proceed, and we should really know. Everyone should know that how important is women's health. Even like as you said, that they too neglect it. So let's, further
See,
discuss on this.
we have to realize why women are important is because they're different. Physiologically, they are different. Their traditional role in family is different. They have got various challenges all through their life, particularly physiological challenges, which starts with menarche, when there are certain changes that is taking place, endocrinal changes that is taking place in the body, menstruation starts, and that is not only physical but also a psychological challenge for every small child which is growing into a womanhood. Subsequently, after marriage and after changes in the body that is taking place, after pregnancy, after childbirth, after lactation, so when lactation starts. So all these phases, and subsequently, when the menses stops and when menopause takes place, or many other peculiar situations that male doesn't undergo and subsequently doesn't feel. These are the things that makes a woman's health more challenging. If not challenging, at least it is different and requires a special care. That is what I would like to put women's health as. And in every phase of life, there are a set of challenges which is a little different and requires addressing in a little particular way. And being in a rehabilitation setup, I suppose it is important for people to realize, particularly women, to realize that there is a lot of aspects that requires not only care from the curative point of view, but also from restorative and rehabilitative point of view. And those are the aspects that requires to be seen. Yeah.
Even with all of this, women are achieving great heights. I mean, if you
Yes, they are
comment on
achieving great heights, and there are certain advantages that women also have. The most advantage is they're extremely dedicated to whatever they do, and it has been seen by general public like me, or even professional educationists, that women by nature are higher achiever. On the average, they are higher achiever than the male.
Yes.
Their ability to focus on to their aim or target or objectives are far more, and consequently in most of the evaluations and examinations they are far ahead. The only problem with women is that society as a large, and families in particular, tend to neglect them, and if we can address that, women are higher achiever, and most of the families are run by women, so you cannot say that they are only those who have achieved recognition are the only achiever. Every family is the actual achiever is a woman, whether it is the mother, whether it's the wife, whether it is the daughter. They are great achievers, and they bring in a little bit of stability in the general chaos that is life.
Moving on to the next question, sir. What is, preventive health, and can you give a little brief on it?
Okay, preventive health is basically anticipating what are the changes that is going to take place in life, and take steps to prevent those problems taking place. And I will give a simple example of pregnancy. When a young lady gets pregnant, and actually the pregnancy affects the whole family, and the husband has got to take equal what should I say, responsibility as far as the pregnancy is concerned. So there will be certain changes that is taking place. After all, child is growing up in the body, and there are associated physical challenges in form of morning sickness and tiredness, sleeplessness. All these can be to a very large extent negated by certain rehabilitative exercises and preparing the body for the event of pregnancy and delivery of child and subsequent lactation, etc. That can be done. So these are the preventive aspects I was talking about. Routinely, whenever a young lady gets pregnant abroad, you must have seen that the couple, the husband and the wife, they go to certain group exercise program, which is known as antenatal exercises, so that the family is prepared physically to make the woman's body prepared for the event, and also mentally of the changes that is going to take place, both in terms of the physical health as well as psychological challenges and social challenges, economic challenges that the person feels. And so these group sessions, that is very important. We had started this, but this works very well if it is in a group, because they can share their problems, their issues, their concerns, and they are able to solve it between them, and concomitantly we can arrange for certain physical activities. For example, after the childbirth, there will be problem with urination. The lady will have dribbling, and those are problems that can be prevented with certain interventions that can be done before the event. Or, for example, a lactating lady will have pendulous breast, so that affects the physical structure of the body. So that can be prevented before the event and concomitantly during the lactation phase. So these are the things that is what I was thinking in terms of preventive health. And lastly,
moving on to the next question. What are the key physical and emotional aspects that young girls face during their Monarch, and why? How rehabilitation supports them?
Well, firstly, because there's a sudden change in a young girl's life when she suddenly realizes that she is different from her brother. So that is by itself brings in a lot of query in her mind.
Yes.
And these
Yeah.
queries have got to be answered. That is one. Second thing is it has got to be told that there is nothing wrong with you. It is a physiological thing. This is a thing that has been blessed by the God for the women, and this they should get used to. There will be certain changes in the body. For example, the changes in the breast, the changes in the size of the pelvis. So, and the way the society is going to look at the woman is going to be different. So, this can be, it is primarily the responsibility of the elders in the family, or perhaps in the women in the schools, teachers, etc. But there is one aspect that can be done by a professional. It can be a psychologist, it can be a physiatrist, it can be a gynecologist. Those are the things that is required. And lastly, to be physically active will improve the mental health also, and that consequently will contribute to the improvement in the child's life.
Sir, moving back to your pregnancy part, what are the major postpartum challenges that women face, and how do rehabilitation aid the issue?
Well, the biggest challenge postpartum that the woman's face is problem with the urination. You see, the birth apparatus puts a lot of physical changes in the body. There is a stretching of the outlet, and subsequently there are pressures on the urinary bladder, and subsequently there is a tendency either of dribbling, that is the urine is not able to, they are not able to control, or there can be also initiation of urination at times may be affected, and these are a little inconvenient for the lady. So that is one thing that I can think of. Postpartum also, because the abdomen has been stretched because of the pregnancy and suddenly it has been void, the uterus will rapidly shrink, but the abdominal wall doesn't shrink that fast. So unless there are certain exercises that we give, there is a tendency for a pendulous abdomen that can be stopped, and through certain exercises we can again bring back the tone of the abdominal muscle. Similar changes will also take place in the breast. It will be, like I mentioned earlier, it will be heavy, it will be full of milk, and it will sag down. As a result, there is again certain changes in the body which may not be very much appropriate to the woman's liking. So these things can be changed. So these are the things that has got to be addressed, and rehabilitation can bring in a lot of and we have got these established programs of during pregnancy, during lactation, or preparing for other aspect of health, because today women has got to go back to their working environment very rapidly. So we have got to prepare the lady for the changes before, during, and after the pregnancy.
I think the next challenge women face in their bodies is the menopause.
Yeah.
And how you can help.
Again, there are changes in the body. Everyone wants to be young forever, but menopause is sort of knock that saying that the reproductive aspect of your life is finishing. What has got to be told to women that yes, because of the physiological changes that is taking place, endocrinological changes that is taking place,
even the psychological.
Yeah, it affects psychologically. Yeah. And many women also start thinking that now my life is over, which is absolutely wrong. What is required to be told to them that it is just a change. There will be, because of the endocrinal changes, there will be certain changes in your bone, particularly muscles, and but necessarily their active life as far as conjugality is concerned is not really affected. So those requires a little psychological boosting, psychological
Moral support.
education, moral support. And that is again was the phase of life when we would like both the husband and the wife or the supporting partner to participate in these changes. And of course, there are in extreme cases we advocate replacement, hormonal replacement therapy, but in most cases it's not required. So those are things that we have got to.
How does simple rehabilitation can help them?
Okay, simple rehabilitation is bone health can be prevented with, it is a easier thing to give some medications and some calciums and some vitamin D and think that the bone health is going to reverse. But if you keep yourself active, you take weights in your body, so the bone health doesn't deteriorate as faster. And also the bone by itself is not the only factor that goes down. It is also the muscles, the ligaments, the tendons. Everything can be reversed, or at least the deterioration can be decreased to a large extent through certain physical intervention, physiotherapeutic intervention that is there. And this is what I was talking about, the preventive rehabilitation.
I think one topic that many of you are not aware of is uterine prolapse. So can you give a brief on that, and how does the rehabilitation help?
Uterine prolapse, uterogenital prolapse is fairly common, and at times because of its obvious nature, the ladies do not report it, and it might cause very disastrous consequences. There will be ulceration formation and even cancerous changes that can take place. And the uterine prolapse particularly takes place because the pelvic floor musculature becomes weak, becomes stretched, and as a result is not able to hold on to the intrauterine organs, and they start coming out of the vagina. Again, rehabilitation is important over here because the primary pathology is the weakness of the pelvic floor, and that can be not only prevented. If it has happened, we can try to reverse it, even with surgically. If it is replanted back, we can stop it from recurring through certain exercises. Very unfortunately, that aspect of healthcare is totally neglected, and we keep it limited to only surgery, which is incomplete. I think there are certain other things that I should mention over here. Caring for the body is very important, particularly women, because by neglecting their body, they are perhaps also neglecting the family, because if the person is not healthy enough, it will not be possible for her to contribute to the family or to the job that she's doing. Two things that is very peculiar to women: one is the breast and the other is the vagina. So the two diseases that is very common is breast cancer and cervical cancer. And these are the two things that has got to be looked into. From the preventive point of view, there has got to be periodic mammography. At least once a year mammography after a certain age should be done. But before that, a physical examination, almost at least, if not daily, weekly basis, the breast should be examined to look for any signs, particularly if somebody has got a family history of breast cancer. And early detection with almost guaranteed cure, and that has got to be looked into. Similarly, a pap smear of the cervical mucosa, that can be done, and these are basically this happens because of certain chronic infection that sets in, and that leads to the certain changes in the epithelial tissue, the covering of the cervix, that is the end of the uterus, and that can be also prevented by periodically checking it, and if there is something, then early intervention can really help. So these are the things that should not be neglected, and I take this opportunity to all the viewers who are seeing this to ensure that they, and if a male is also watching, must take their lady wives and mother or daughter for this periodic checkup, because stitch in time will prevent you from putting 9.
Right, sir.
Anything else you'd like to know? I suppose, again, this is an opportunity. You must understand that the body is where you house the God, and if you consider in that manner, it is a temple by itself and it cannot be neglected. You
Correct.
have got to look after yourself. And on this day, the 8th of March, we celebrate it because womanhood deserves celebration. And again, all the very best to all the ladies and their loved ones. We celebrate this day, but we must also celebrate this attitude for the rest of the year. Thank you very much.
Thank you, everyone. Thanks for watching us. And I really hope that through this video, we are making aware more about women health and help a lot of women out there. Thank you.